Hello, everyone, and welcome to Mission Possible, Changing the Course of Dementia, a Growing Public Health Crisis. I am Molly French, Director of Public Health for the Alzheimer's Association Public Policy Division, joined by the Associate Director of Public Health, Mr. John Sheehan. We have a wonderful panel of experts today to talk about Alzheimer's and other dementias from a public health lens, and then provide you with an overview of the new Healthy Brain Initiative roadmap that we're releasing today and share strategies, importantly, for changing the course of dementia. Please know that we are recording today's webinar so that it's available to others who couldn't join us. Today, after the webinar, please look for an email asking you to answer a couple of questions to help us evaluate it and improve on our work next time. Next week, yes, we will send to all webinar registrants a link to the recording and also to the roadmap, as well as other resources that are featured. So be on the lookout for that. I do want to acknowledge, with a lot of gratitude, support from the Centers for Disease Control and Prevention, or CDC, that enables us to offer this webinar. But of course, the opinions expressed during the webinar are solely those of the individual presenters. We do want to thank CDC, the Association of State and Territorial Health Officials, the National Association of Chronic Disease Directors for co-hosting this important webinar. We're going to start today with CDC giving us an introduction to the growing burden and impact of Alzheimer's and other dementias on the nation. And then the Association of State and Territorial Health Officials and the National Association of Chronic Disease Directors will each speak about the need for a public health response to Alzheimer's and other dementias. And then we have the privilege of hearing two different examples of how state public health departments are taking steps to realize a better future for all communities impacted by dementia. Today we're only going to be doing a Q&A. We will have a Q&A session towards the end, and it will be based on the questions and the comments that you submit in the chat feature. So please do help us provide a lot of value back to everyone else by using that chat feature. If you're just joining us, I am Molly French from the Alzheimer's Association. Do thank everyone who's on the line and on the WebEx platform for joining us. It's also a great privilege today to have so many distinguished presenters be part of our release webinar. So we can spend a little more time benefiting from their knowledge and experiences. I'm just going to provide their names and titles and just say I'm professionally in awe of their contributions that they've each made to the public health field. We'll hear first from Dr. Lisa McGuire. She is the team lead for the Alzheimer's Disease and Healthy Aging Program at the Centers for Disease Control and Prevention. Later, then, we'll hear from Ms. Erin Bayer, who is the Senior Director of Health Improvement and Chronic Disease Prevention at the Association of State and Territorial Health Officials. She'll be followed by Ms. Sandra Hinches, who is Chief Bureau of Cancer and Chronic Disease Control in the Missouri Department of Health and Senior Services. Then Ms. Taya Griffin, she is the lead for the Alzheimer's Disease Interest Group for the National Association of Chronic Disease Directors and is Director of Education and Training in the Bureau of Community Integration and Alzheimer's Disease at the New York State Department of Health. And we are also joined by Ms. Megan Fidel. She's the Director of Evaluation and Collaborative Projects for the Bureau of Community Integration and Alzheimer's Disease at the New York State Department of Health. The presentations today aim to enhance your knowledge about the growing impact of Alzheimer's and other dementias. You also learn why the mission is possible, why public health actions needed today working across the lifespan, and how the new Healthy Brain Initiative roadmap helps public health leaders chart a course for a better future. We'll also feature briefly some different resources that are available in the data to support roadmap planning and implementation. Just a little bit of quick background about the Healthy Brain Initiative. In 2005, the Centers for Disease Control and Prevention the Alzheimer's Association, and other public health partners, with some congressional support, formed the Healthy Brain Initiative, or HBI, to really integrate cognition and dementia caregiving into public health efforts. The Healthy Brain Initiative has had a strong history of collaboration through the years. And for example, some of the accomplishments include working with the behavioral risk factor surveillance system to collect data on cognitive health and functioning and caregiving. Also in 2010, Healthy People 2020 began for the first time including national objectives on dementia and caregiving. And then since 2007, there's been a series of roadmaps, the square books that you see there on your screen. These have really been a central tool to provided public health with critical insights and guidance to the on Alzheimer's and other dementia public health issues. We are so thrilled and excited to be able to finally share with everyone the third Healthy Brain Initiative roadmap. We just released it today, and it has a lot of different expert-guided actions, case studies, and implementation guidance to enable you, our participants, to efficiently and effectively address cognitive health across the life course in your existing public health function. And then for the first time this winter, we will have a new aspect of our roadmap series, a roadmap for Indian country that is tailored to serve Native and tribal health leaders, providing just a tool for them to start conversation with their communities about the growing number of elders who are affected by Alzheimer's. Dr. McGuire, will you tell us more about how Alzheimer's is impacting the nation?
Thank you very much, Molly, and thank you for coordinating this webinar today. We at the CDC are really excited about the release of the Healthy Brain Initiative Roadmap. And as I delve into a little bit of the background of what was really stirring us to revise the roadmap and to the action items, I want to talk first about what dementia is. So dementia is not in and of itself a disease. Rather, it is an umbrella term for a set of symptoms characterized by the loss of cognitive function that is severe enough to interfere with a person's daily life. There are several different types of conditions that can cause dementia, and Alzheimer's disease is the most common type. However, it's important to know that many scientists believe that the majority of dementias are mixed, meaning that somebody may have multiple causes to the symptomology that we are seeing. Alzheimer's disease is now the 5th leading cause of death of Americans over the age of 65 years old and older. We know that the death rates from Alzheimer's disease have increased from 1999 to 2014. This recent CDC publication shows that those Alzheimer's disease death rates increased 55% for all age groups, and the increase was the largest in those 85 years old and older. This graphic illustrates another set of recent findings from the Centers for Disease Control and Prevention. This shows some new estimates based on racial disparities related to, for those people who have Alzheimer's disease and related dementias. So the left side of the graphic shows us the differences in prevalence by various races and ethnicity. The right-hand side of the graphic shows us that our analysis suggests that between 2014 and 2060, we expect that Alzheimer's disease will nearly triple in the United States. A few more facts that we considered in developing this new roadmap. One of the things that we thought about is making sure that people are aware of their diagnosis, either the person with dementia or their caregivers. We know that only about 35% of people are aware of their diagnosis. We know of those individuals who do have dementia that 25% of their hospitalizations are preventable. So we will talk, and we were thinking about, as designing the roadmap, the importance of managing comorbid chronic health conditions. The next statistic shows us that 95% of Medicare beneficiaries with dementia have one or more chronic health conditions. So we need to keep in mind when we talk about a person with Alzheimer's disease and related dementias, chances are they have at least one other coexisting chronic health condition. We also need to be aware that the majority of people with dementia do live in a community setting, and many of them rely on caregivers for support. And we know that when we look at the health of caregivers, 1 out of 3 caregivers to a person with Alzheimer's disease and dementia reports that their health has worsened. Now, the CDC is a public health agency, and I like to show this slide to illustrate the differences in the approaches that somebody can approach a problem such as Alzheimer's disease and related dementias. The left side is the more traditional approach, where we are helping one person at a time. The right side of the graphic is the public health perspective, in which we are helping groups or communities of people simultaneously with the intervention or the approach. The next graphic shows us some of the things that we now understand as science has evolved related to Alzheimer's disease and related dementias. We know that this is a life course disease, or a life course perspective must be taken. We understand that the changes associated in the brain with Alzheimer's and other dementias may take root many years, even decades before the symptoms appear. This graphic shows us in purple the dementia continuum, from the healthy cognitive functioning all the way through to dementia. The blue components show us the public health community where we can intervene by promoting health behaviors to reduce risk of cognitive decline, encouraging early detection and diagnosis of cognitive impairment and dementia, ensuring the safety of those who have memory issues, and improving the quality of care for people impacted by dementia in the communities where they are residing. So how can public health help? So much of the information I've given you so far has led us to these topics and themes that are evident in our new roadmap that is being released today. Next slide, please. So the roadmap that we see here on the left utilizes the framework on the right. The framework is a modified version of the essential services of public health. Our roadmap is organized into 4 essential public health: assuring a competent workforce, monitoring and evaluating, developing policies and mobilizing partnerships, and educating and empowering communities. Within these 4 domains, we were guided by 3 core principles: to reduce health disparities, collaborate across multiple sectors, and leverage resources for sustained impact, which, as we all know, is extremely important for public health to truly make an impact and a difference in people's lives. The next 4 slides are highlighting for us the action items that are included in this new roadmap we're talking about today. The roadmap consists of 25 action items. All of those items are equally important, and they fall within those 4 essential services of public health. One of the questions that we received on our previous 2 roadmaps is, how do I get started? Where do I start? If I have limited resources, what are the best places for me to start? Our leadership committee put our heads together and identified 12 action items that are particularly feasible and relevant. They are not necessarily more important in the grand scheme. All of the action items are important, but if you're looking for a place to start, these might be a good place to start. The first, First set of action items is educate and empower. So this really here is getting knowledge into people's hands and providing them information about dementia and caregiving to really empower them in their lives. The second characteristic or second set of action items is developing policies and mobilizing partnerships. So really within the public health perspective, we're trying to integrate these successful interventions and best practices into policies and practices and educate policymakers and decision makers about the importance of cognitive health and cognitive impairment and really what a difference public health can make. The third is assuring a competent workforce. So when we're talking about assuring a competent workforce, we're talking about training future professionals, healthcare and medical professionals, to make sure they have the skills and tools needed when they enter the workforce, as well as helping prepare those that are existing in the workforce and providing them information and continuing education about the latest science and the latest innovations in the field that can help their clients' health. Finally, we are talking about monitoring and evaluating. And so we know within public health, we need data. We need information to know what's going on in our states and our communities so we can design interventions and programs and use that information in ways to target things that we are doing to improve people's lives. One of the ways that we are doing that and that we support roadmap planning and implementation is some of the data that is collected at the CDC through the Behavioral Risk Factor Surveillance System. So on the Behavioral Risk Factor Surveillance System, there's a subjective cognitive decline module. And on this subjective cognitive decline module, people are evaluating their own memory, people 45 years old and older. And they're indicating if their memory has worsened in the past year. If these changes in memory are making differences in their daily lives, are they having to adjust their work or volunteer schedules? Have they discussed any of their memory changes or concerns with the healthcare provider? The right side, the map of the United States, shows you by color the year that the various states and territories have implemented the subjective cognitive decline module. If a state has flash patterning, that indicates that they have administered the module in both years of the patterning. So what do we know from some of the findings from the subjective cognitive decline module? So in a paper that Dr. Taylor from the CDC published in July, we know 1 in 9 Americans aged 45 years old and older are reporting memory loss and confusion. And about half of them say that they have limitations in their daily lives related to those changes. We know that a little more than half of the people with memory loss have not talked with a healthcare provider. So with caregivers, CDC has a module on caregiving. So for adults 18 years old and older, we know what the characteristics of those caregivers are. We know how old they are. We know the health problem of the person they're providing care for, the problems that they face as caregivers, what some of their greatest needs and challenges. And if somebody is not a caregiver, we ask them, do they expect to become a caregiver in the next 2 years? A similar map of the U.S. is on the right-hand side, showing the years the states did administer the caregiving model between 2015 through 2017. CDC has, in partnership also with the Alzheimer's Association, has developed infographics. What you're seeing here is the infographics for the nation for both the caregiver infographic and on the right-hand side, the subjective cognitive decline infographic. These infographics are available on CDC's website, cdc.gov/aging. They're available under the statistics section. So the graphics you're seeing here are national level, and the CDC website does have state-specific infographics that are available for your use and download. So in summary, Alzheimer's disease and other dementias affect millions of people in our country. It's costly and it's growing. The public health community must act now to stimulate strategic changes in policies, systems, and environments. We hope that this new roadmap will help partners chart a course for a dementia-prepared future. And there are tools and resources available for implementing and planning your course that are state-specific on subjective cognitive decline and caregiving. Thank you very much. Ms. French?
Oh, thank you so much, Dr. McGuire. And if I may ask my presenters to just put themselves on mute until I call upon you. We're hoping to eliminate a little bit of background noise. Thank you. Next, I would like to ask Ms. Erin Bayer to present.
Thank you, Molly, and good afternoon, everybody. Thank you so much for having me. As Molly mentioned, I'm Erin Bayer, the Senior Director at ASTHO. Next slide, John. So I imagine that there are a number of you on the call who are not familiar with our organization, so just a brief overview of ASTHO and the work that we do to help better understand the partnership that has existed. So we are the Association of State and Territorial Health Officials, and we're a national nonprofit organization, and we work with both states and territories at the state level public health to ensure high quality, comprehensive state-based public health. So as you can see here from both our mission and our vision, our goal really is for optimal health for all. And that's important because that includes the aging population and those living with Alzheimer's and dementia, and as well as their caregivers. And so we do this and hope for this vision to be accomplished by working with state and territorial health officials and their leadership teams and staff. Next slide, please. Thank you. So in 2016, we were really fortunate to be able to, and had the pleasure of working with the Alzheimer's Association on a project to really foster a partnership between state-level public health and the state Alzheimer's Association chapters. And as you can see from the slide here, that every year we added a number of additional states. And so throughout the project, each state partnered, the partnerships that existed, they worked to implement at least 2 action items from the previous Healthy Brain Initiative roadmap, so the one that took place from 2013 to 2018. So, and a couple of the goals that, of this particular project were the promotion of cognitive functioning, addressing cognitive impairment and Alzheimer's disease, as well as helping to meet the needs of caregivers. So we experienced significant success throughout all of the states, and there are tons of examples that we could have pulled from and been able to highlight today, but you'll have the pleasure of hearing a little bit more specifics from the wonderful state of Missouri. But just a few things before we turn it over to Missouri that I'd just like to mention in having this involvement and having this partnership, things that were pretty key for us. And partnerships. So partnerships are always invaluable in public health, and not just the partnerships with the Alzheimer's Association state chapter. And again, if you could please mute your phones if you are, if they're not already. So not just the Alzheimer's Association state chapters, but it was really important to look within state level government, because oftentimes it varies from state to state as to where the aging division falls. So perhaps that falls within the public health department, but perhaps it's different in a different separate division. So it's really crucial that those 2 groups have constant communication and that they're really working hand in hand to address Alzheimer's and other aging-related issues. And so that was really a key finding, and and whether that means partnership and working together and having conversations, but also looking at funding too. Funding is very limited, unfortunately, in these areas. So looking at ways to really maximize resources and making sure that full utilization is there. And then I believe Lisa might have mentioned, but the more people working together, the better. So that was certainly a key. It's also important to know that every state's going to look very different. Every state's going to be at a different starting point as to what existing resources are there, what the receptivity is going to be, and what work has taken place prior. So with the implementation of the roadmap, it does look very different, and what the beauty of it is being able to adjust it accordingly and looking at what gaps exist and how to fill those and how to enhance other areas. And then lastly, one thing that we found really beneficial was ensuring that the roadmap, that the action items associated with the roadmap, that they were incorporated into the state health improvement plans. This is a plan that every single state has. And so this helps to place a higher value on the work related to the roadmap. And then also it just makes more people aware of this important issue and important topic. So we certainly look forward to continuing this partnership with the Alzheimer's Association as well as CDC and other partners, and we look forward to state-level public health being at the table and, again, continue to see the value as we move forward in implementing the new roadmap. And as mentioned, you'll now hear from the experience of Missouri, and so I will turn it over to Molly. Next slide. Thank you.
Thank you so much, Ms. Bear. And Ms. Hinges, would you now present for us, tell everyone about the wonderful things going on in Missouri?
I would be happy to, Molly, and good afternoon, everybody. My name is Sandra Hinches, and I am the Chief of the Bureau of Cancer and Chronic Disease Control with the Missouri Department of Health and Senior Services. Next slide, please. I just wanted to give everybody a little bit of history about how we became involved with the roadmap. So basically, the Department of Health and Senior Services, specifically our particular section, we call that DCPH, the Division of Community and Public Health. We met with the Alzheimer's Association to discuss Alzheimer's and specifically how it impacts public health, which is kind of a different spin for us. It was kind of a new concept. In the past, the disease was focused on in our what we call Senior and Disability Services unit, or the Unit on Aging. So the public health spin was kind of a different avenue for us, and we welcomed it with open arms. We met in Washington and made a draft of a plan that utilized some of the existing resources we had in our section, including existing chronic disease programs and community health workers. The plan was used basically to get the message out. We wanted to focus on early detection. We wanted to raise awareness, not only among our partnering organizations, but also within the general public, targeting both caregivers and those who have Alzheimer's disease. Within the department, we continue to meet with the Unit on Aging, and we closely with them on initiatives that we can both kind of go in the same direction, leveraging resources and having an increase in programmatic reach. Next slide, please. The importance of addressing brain health from a chronic disease standpoint. Brain health is directly related to good nutrition and physical activity, and of course those things also correlate directly to reduce the prevalence of chronic diseases such as heart disease and diabetes. And we kind of like the motto that the Alzheimer's Association has, which is what's good for the heart is also good for the brain. And we kind of took that and ran with it in our messaging. Alzheimer's, of course, is becoming fast becoming a major public health concern, and I don't need to tell anybody, but just basically as many as 16 million individuals will have the disease by 2050, and that's pretty concerning. So we feel like it is our duty as public health servants to do what we can to spread the message, to raise awareness, and to do all that we can to prevent and delay the onset of Alzheimer's. Early detection is key to early treatment. Educating the public on warning signs and services that are available to diagnose and treat Alzheimer's was a major area of focus for Missouri and the public health area. Next slide, please. So I just want to kind of go over and give you an overview of the HBI roadmap initiatives that Missouri took on with this. And we did, first of all, E1, which is to identify and implement culturally appropriate strategies to increase public health awareness about dementia. And we did this through several ways. We provided educational information and materials to raise awareness of Alzheimer's and associated risks. And we wanted to promote the importance of cognitive brain health, because it's not just about Alzheimer's and the diagnosis, but it's also about what can we do to prevent that. And this was accomplished through the incorporation of several things: web links to brain health resources, referral information that we put on our website, and then the distribution of educational materials to both external and internal partners. And then we also did a series of presentations to our internal and external stakeholders to raise awareness of the importance of cognitive brain health. Okay, Our next initiative that we took on was E4, which is to disseminate evidence-based messages about reducing the risk for cognitive decline and preserving cognitive health. And we did this. This was one of the main focuses of our interventions. And we worked with media contractors to develop kind of a multifaceted social marketing campaign. And it was aimed at populations in our southeastern region of the state who are in need of educational materials. And we made sure that they got what they needed there, because we disseminated those materials and promoted brain health, but also provided information targeting caregivers primarily on information about Alzheimer's, about early diagnosis, and again about treatment. So there you go. Next slide, please. The next initiative we took on, kind of wove it in with everything that we were doing, is to integrate cognitive health and impairment into state and local government plans. And this is where our state health improvement plan came in. We were able to incorporate a goal and objective around Alzheimer's outreach, cognitive brain health outreach, and education, the dissemination of educational materials. And so we were very happy that our upper management was very supportive of us incorporating that particular goal and objective with relation to that. We also, we have a chronic disease state health plan as well. And we also talked with our Coordinating Council on Chronic Disease about incorporating some goals and objectives within that plan. We're due to start planning and developing our next 5-year plan, and the group had agreed that we could incorporate some information and some objectives and strategic initiatives around Alzheimer's. So we're very excited about that. And then we took on W06, which is educating healthcare providers about validated cognitive assessment tools. And so this is where our community health worker group came in. We worked very closely with our program manager for the community health worker program within our Missouri Actions to Prevent Chronic Disease. That's a grant that we received from CDC. And she was very amenable to helping us to educate the community health workers statewide about the AD8 screening tool and how to use that in order to help folks to realize, okay, there may be a problem, and then refer those folks to providers for actual testing, diagnosis, and treatment. And that was a really good experience, because the Alzheimer's Association worked with us, and also the St. Louis University worked with us to develop this tool. They didn't charge us a cent, which I thought was just wonderful. And the tool was very helpful. Our community health workers had an online module that they took. And we're hoping to continue to promote that, and we will keep that online module as a piece of their additional education. And we will continue to promote that throughout the years to come. So that's very sustainable, and we plan to really run with that in the future. Next slide, please. Okay, partnering organizations that really made a difference for us. Of course, the one that we worked with the closest was the Alzheimer's Association here in Missouri. And I'm telling you, everything I needed, they were just more than happy to give me educational materials. They came and did presentations. They collaborated with us on our social marketing campaign so we could really figure out what the best way to reach a good number of people would be. The input and the resources and the materials were just phenomenal. So kudos to the Alzheimer's Association. As our department of our unit on aging, we collaborated with them very well, because we didn't want to duplicate what they were doing, but we wanted to enhance what they were doing, and then we wanted to have kind of like a collaboration between us so that we could, again, increase our reach and leverage resources to really make an impact. Also, the Community Health Worker Advisory Body was very helpful in promoting the module for the 88 tool, and so I've got to give that shout out to them, and we will continue to work with them in the future to continue to educate community health workers around cognitive brain health and Alzheimer's. The Missouri Hospital Association was also a key partner, and the neat thing about that is that the Alzheimer's Association was able to give a really good presentation to some of the providers about all of the services that they offer, referral services. It was just really good presentation, and we continue to work with the Hospital Association, especially in our work with chronic disease. And then finally, our social marketing firm, Elasticity, we've got to give them credit because they really helped us to design a very good social marketing campaign. We had 4 facets. We targeted Facebook. We did geo-targeting on smartphones. We also did radio ads for both Pandora and local broadcasting. And then in addition to that, we included inserts in the local publications in the southeastern region of the state. So they were instrumental in helping us to plan that, as well as our Office of Public Information. Next slide. We think the outcomes we're anticipating a greater awareness of Alzheimer's and the importance of cognitive brain health among chronic disease partners, looking at Alzheimer's as a chronic disease. We are hoping that there was a greater awareness among local public health agencies because we did disseminate a lot of information to them and their partners. A coordinated effort among all partners to disseminate information to the general public related to Alzheimer's. So, you know, that coordinated effort among all of our partners was just key. And most importantly, we believe there's a greater awareness of cognitive brain health, how that's all related, physical activity and nutrition, and then a greater awareness of Alzheimer's and the resources available for caretakers and the general public. Next slide, please. If we could give any tips for public health leaders, it would be these 4. We could do so many more, but we have 4. We believe that messaging is everything from a public health standpoint. Be sure that your message coincides with public health principles and that the messages are health literate and targeted.
Added another night for ATH Hotel. So,
another piece of that is that the partnerships are vital to a successful intervention and an awareness campaign. So the partnerships are key so that you can leverage resources and increase your reach. And coordination of efforts is crucial in message dissemination so that you don't duplicate efforts. And then recognize and build upon the notion that, again, what is good for the heart is also good for the brain. And that's all I have. Molly?
Oh, thank you so much, Sandra. Really appreciate that. You know, I love how Missouri has really stood up a robust, kind of multifaceted approach, cross-sector approach to Alzheimer's. Ms. Sadie, our operator, we are hearing quite a bit of background noise, and I don't know if you'd be able to help us minimize that.
Sure, I'll do my best.
All right.
I'll do my best to minimize the noise.
All right, thank you so much. Now it's my pleasure to turn it over to Ms. Griffin.
And did you say Taya Griffin? Oh, I'm sorry, I didn't hear that part. Hi, thanks, Molly. I will briefly talk about the National Association of Chronic Disease Directors and who they are, their mission and purpose, along with some of the accomplishments and work around Alzheimer's disease and the implementation of the HBI roadmap. Next slide, please. This national public health organization unites over 7,000 chronic disease directors and professionals across the country working in state, tribal, territorial health departments, nonprofits, academia, and private industry to promote good health and to reduce the burden of chronic disease. The way they improve the health of the public is by strengthening state-based leadership and promoting partnerships. Partnerships seems to really be the key, as stated previously. And the members are responsible for implementing the plan, and they decide how funds and resources will be used and focus on where they're most needed. The HBI roadmap is really an essential tool for them. And since 2015, NACD has hosted their Alzheimer's disease interest group with state officials and partners meeting quarterly to share best practices and lessons learned for public health strategies, including implementing the roadmap. Next slide. States and their partners present to the interest group on important topics, programs, and ways to advance the issues around ADRD. They're really doing some very exciting and important things and activities and actions around implementing the roadmap. And it turns out that most states have their own state plan and their own roadmap in one way or another. They recognize and implement the strategies of the roadmap and focus their priority activities based upon the needs of the population, the issues particular to their state, and again, about the available resources in their state, which seems to be a very common theme. And by joining and being part of the interest group, more states will have more info and what other states are doing and being a resource to each other, and that's a little bit of a plug. We've signed on support on the passage of the Building Our Largest Infrastructure for Alzheimer's Act, the BOLD legislation, and BOLD will also increase implementation of the HBI roadmap. They share resources for the advancements of the BRFS strategy. And state-level planning is important because Medicaid is a primary funder of long-term care services and long-term care in general, which is administered by state government, so that makes sense. And another way that the AD interest group advances the implementation of the roadmap is by educating internal and external partners by using CDC and the Alzheimer's Association materials. Next slide. And some of the NACDD actions include the web-published Alzheimer's Disease Policy White Paper, which was distributed to the current administration. And now they're vetting plans for the new white paper. This larger group advocated and supported the passage of BOLD, which, as you know, is the public health strategy based on successful models and current science. Letters in support of were sent to Congress. Also, ongoing education of members and partners, especially how Alzheimer's disease is a critical public health issue and what can be done about it. And the NACDD Advisory Network shares related information materials. As an example, their Office of Government Affairs successfully advocated for increased national funding for Alzheimer's disease. In the appropriations bill, there is an increase of $1 million in the Alzheimer's line for 2019. So in conclusion, NACD and their Alzheimer's interest group are very committed and demonstrated this commitment to the success of the implementation of the HBI roadmap across the country on the local, state, and federal levels, and look forward to the continued partnerships. And now I'll turn this over to Megan Fidel.
Hi, everybody. So I'm going to share several examples from our experience here in New York State, some of which would be easy for any state health department to implement, others not so easy, but both of which I think are valuable and achievable. Next slide. So first, I want to share why I think it's so important that we as state health departments address Alzheimer's disease. At a state level, we certainly see the impact, both in costs to Medicaid and our healthcare system, also in the impact to our statewide community of caregivers and people with dementia. As state health departments, we are uniquely poised to make an impact. We have the opportunity to address this disease from a population health and systems perspective to make more of an impact, as we have for cancer, for AIDS, and for so many other diseases. So please consider this both as a case study and also as a call to action. Next slide. First, I want to discuss a major intervention that addresses several of the categories from the Healthy Brain Initiative. The Alzheimer's Disease Caregiver Support Initiative represents a landmark investment in clinical and community support for people with dementia and their care partners. It consists of a twofold approach. On one hand, investing in community support and education, and on the other hand, investing in diagnostics and professional training and emphasizing the linkage between the two. For those who may be interested in implementing similar in their own state, just thinking about logistics, the way we administer this program is through a series of grants, which enabled us to contract with community partners for service delivery. Working with community partners was key for a few reasons. It allowed us to extend our reach with organizations already embedded in their communities. It allowed us to tap into their shared expertise. And it also enabled us to strengthen the network of providers across the state, not only through the investment, but also through various education and regional meetings meant to foster collaboration among our providers. Of the examples I have, this one won't be the easiest of them to implement, but there is absolutely potential for other states to do similar. And as with any of the examples I share today, I would be happy to connect more with any of you to discuss lessons learned from here in New York. Next slide. The community support and education end of the support initiative are grants informed by an extensive and growing body of evidence demonstrating that providing caregivers with a core set of services can help reduce burden and promote health. The services most common to the evidence-based caregiver interventions and those that we use in our programming include care consultations, support groups, education, respite, and we also fund a statewide 24-hour helpline. You'll see on this slide service numbers from the first 2 years of our initiative. Next slide. On the other hand, we also have our Centers of Excellence for Alzheimer's Disease. This portion of the initiative in particular speaks to the Healthy Brain Initiative efforts aimed at achieving a competent workforce. Our 10 centers across the state are tasked with multiple goals, including providing the standard and quality care for diagnosis and care management, training physicians and healthcare providers, and promoting the involvement in clinical trials. We know that research indicates that many people with dementia never get a diagnosis, and as Lisa mentioned earlier, only 35% are aware of their diagnosis. The Centers of Excellence, through training of providers especially, can really make a difference on this front. Next slide. Considering the Healthy Brain Initiative target activities around evaluation, we're also very happy to have an evaluation as a part of our initiative. Here again, a partnership has been key to our approach. We've contracted with SUNY Albany to conduct the evaluation in collaboration with the Department of Health. Without going in depth for the sake of time, I've highlighted a few emerging themes coming out of the evaluation process, and I want to note that we do have a report available with more reports to come over the next several years. Next slide. We've also found it very helpful to implement the caregiver and cognitive decline modules of the Behavioral Risk Factor Surveillance System for many years, and we use this data both to inform and to justify our approach. So for example, we know from this data that New Yorkers who report concerns about their own cognitive health, 53.4%, so over half of them, have not talked to a physician about their concern. This helps suggest that both our community and clinical support activities and the linkages between the two in particular are so important. And this measure from the BRFSS will be a valuable long-term indicator of our success in addressing this gap. Next slide. We're also very lucky to have a Commissioner of Health who sees the importance of Alzheimer's disease as well as the needs of caregivers. He regularly issues Dear Colleague letters to providers across the state. And we've had the opportunity to collaborate with him and his team to issue several that address new developments in the field of Alzheimer's disease and best practice approaches to care. This has further helped educate the professional workforce. Next slide. Public Health Live webcasts are designed to support the development of the workforce as well. By partnering with SUNY Albany, we're able to provide trainings that include continuing education credits. We also use this as an opportunity to tap into the expertise of our community providers. So just a few examples on this slide from ones that we've offered include one on advanced directives, which utilized Wayne Shelton from the Albany Medical Center. one on cognitive impairment screening, which features Dave Hoffman, an ethicist and professor, and our former bureau director. And last but not least, determining caregiver needs and well-being, which features Beth Bovin of the local Alzheimer's Association chapter. These are all available online for anyone who's interested in viewing them. Next slide. We collaborate internally with our public affairs group to issue public awareness content via tweets, Facebook posts, and our public listserv. You can see here an example of a sample tweet that we've shared that helps promote awareness about the warning signs of Alzheimer's disease and promotes early diagnosis. Next slide. And finally, there are some important policy efforts and collaborative projects that are helping to make change for people with the disease and for caregivers. I know we're short on time, so I won't go into depth on each one, but just to briefly mention a few, our Coordinating Council for Alzheimer's Disease is a body of experts that includes not only external community partners and researchers, caregivers as well, but also various government agencies beyond just the Department of Health. We've used this as a way to inform our state plan, and they all contribute to achieving the goals that we outline in that plan. The Alzheimer's Association Workplace Alliance is an easy lift and a way to provide support services and education internally in the workplace at the Department of Health. And the Alzheimer's Disease Assisted Living Voucher Program is an exciting demonstration project we have going on right now in order to prevent unnecessary transfers to skilled nursing facilities. Last but not least, paid family leave is a really important policy change. New York State is one of the first to implement this, and this will support people with Alzheimer's disease and their care partners, among many others. Next slide. So I want to end with 3 tips that summarize some themes that cut across all of the examples that I shared. First, I've given several examples where collaboration with community partners has been key, and we encourage you to do this to amplify your reach. Secondly, it's great to utilize the extensive evidence base that exists, as well as surveillance data to support and justify your interventions. And last, we encourage you to establish intra- and interdepartmental connections working towards similar goals. The work we do to address Alzheimer's disease is not limited to our Alzheimer's disease program or even solely to our Department of Health. Working together, we're able to achieve much more. Next slide. Thank you so much for this time. Please do not hesitate to reach out to myself, Megan Fidel, and I've also included the contact information for Taya Griffin, who coordinates the Alzheimer's Disease Interest Group for NACDD. Thank you so much, and I'll pass it back to Molly.
Oh, thank you so much, Ms. Griffin and Ms. Fidel. I will say, you know, New York has been working in the Alzheimer's space from a public health approach before the Healthy Brain Initiative. But, you know, so I love the presentation. It provided both, you know, actions that public health departments just getting started on this journey can readily do, but also the examples of a more of efforts that require additional capacity. So that was really terrific, and it's so helpful to have those practical examples. Thank you for everyone who's submitted questions and comments via chat. We'll start that in just a minute, but I did want to turn things back to Dr. McGuire for a few reflections.
Thank you very much, Molly, and to all of our stellar presenters this afternoon. A common theme that I heard today was partnership, partnership, partnership. I think, you know, we in public health all know this, but I'm just hearing the examples of what different states have been able to do really illustrates that for us to truly, truly make a difference, we do have to work together. And I'll turn it back to Molly.
All right. Thank you. So we did have a couple questions and comments via chat. One that I'll answer briefly is that, yes, we will be sending out the slides and recording after the webinar. Do hope that you'll take advantage of those and share them. We also had a question for Dr. McGuire. One of the participants was wondering where they can get the infographics.
Yes, we'd love to have you take a look at our infographics. They are at cdc.gov/aging, and there is a button on data and statistics, and if you click there, you'll get right to the infographics as well as our data portal, which has a lot more other data available for older adults.
And thank you. Ms. Griffin, this question is for you. Someone was wondering who can join the NACDD Alzheimer's Interest Group?
Hi, sorry, I was on mute. Anybody can that represents the states, probably anyone who's part of this this group, and you can just reach out to me. My email address is right there on the presentation.
Yes.
So contact me, and we can talk more about it on how to do that.
Oh, that's so wonderful. It's been a fantastic group and a great service that NACDD provides to the state public health community. I will include Taya's email in my follow-up email next week. Just in the interest of honoring everyone's time commitment, I do thank our presenters. I do want to go on and say and just encourage everyone on the webinar that you can go to alz.org/publichealth to download the new Healthy Brain Initiative Roadmap. And while you're there, please make sure to look at our greatly expanded website. You can find additional examples of the wonderful work of implementing the roadmap that's being done by state and local public health departments across the country. You can get your BRFSS data and find other resources, such as those in particular that Sandra was mentioning for in Missouri, as well as some of the examples and resources created by New York. And again, just want to thank everyone. It was truly an honor and privilege to be able to have these fantastic presenters with us today so we can learn from their leadership. They've really been on the forefront of adapting the strategies in the Healthy Brain Initiative Roadmap to improve outcomes and make a difference in the lives of people who are affected by Alzheimer's, other dementias, their caregivers, but also helping keep all of us in good health as we grow older. We are also grateful for our webinar participants who joined us. Thank you so much for taking an hour out of your day to do so. When you see an email from me this afternoon or tonight, please do take a couple minutes to give us feedback on the webinar. There's also a link there on your screen. And next week I will be sending out a follow-up email. If you do want to learn more about the Healthy Brain Initiative and the Public Health Roadmap, please do either go to our website, alz.org/publichealth, or to the cdc.gov/aging. You'll find a lot of different resources and materials and tools on both websites to assist you. Again, thank you everyone for just a wonderful webinar.